let me start with a small background information. In the original Clarity trial and its extension, there were only 4-year follow-up in patients treated with Cladribine. And we wanted to know what's going on beyond this time point. And also we wanted to look like on patients who were pretreated, who were older than in the trial. So we wanted to look at real-world data. For this, we used the Czech National MS Patient Registry, which covers more than 80 or 85% of Czech population. So it's quite a coherent cohort. And we identified until the end of year 2025 around 2,000 patients who initiated Cladribine. And out of those 2,000 patients, 500, almost 500, had at least 5 years of follow-up. From those patients, more than 90% were pretreated. They weren't treatment naive, so we need to think about it when trying to understand our outcomes. And out of these 500 patients, about a half of them in the 5th year didn't need switching therapy or additional retreatment, additional Cladribine course. So half of them just remained okay after first 2 courses. A quarter of those patients needed retreatment with another Cladribine course, and a quarter of them were switched to another treatment. When we look at outcomes after those 5 years, only about 42% of patients were relapse-free, but most of relapses occurred within the 1st and 2nd year. So that's something we can expect. And after that, relapse rates were really low. And about 72% of those patients were confirmed disease worsening free, and about 89% of patients were PIRA free. That's quite a good number, I think. When we look at specifically at retreatment subgroup, at those at that quarter of patients who were treated after 5 years, or among those 5 years, we can see that retreatment can be a really beneficial strategy, because in the year prior to retreatment, about 40% of patients are relapse-free, but in the year after Cladribine retreatment, it's 80%. So it looks really nice. As a lot of people are thinking about Cladribine as an exit disease-modifying treatment strategy in multiple sclerosis, we looked at subcohort of patients older than 50 years or 50 years old and older. And we saw that the numbers are even better. About 65%, I think, didn't need to switch therapy or to have a retreatment. So although numbers are quite low in this subcohort, we have about 50 of those patients. It seemed that Cladribine can be a good exit strategy. So to conclude this poster, I would like to say that about half of the patients, despite being not treatment naive, do not have need to be switched or to be retreated. But in the subgroup who got another treatment course, who were retreated, retreatment seems to be a good strategy to control the disease activity. And also that in the older patients, Cladribine treatment can be a good exit strategy.